Hello, everyone. It's Monday, August the 10th. While our numbers, and I'll get into our numbers in just a second, from the standpoint of our daily rate and our cumulative rate, our numbers appear to be slowly getting a little better. But the number of deaths that we have to report today is staggering. You know, considering the fact that this number is somewhat distorted from the standpoint that there is multiple deaths at the Mercer County Nursing Home that have been in the process for days now before they were, accumulated and reported in. But now we have 8 deaths in the Mercer County Nursing Home that we're reporting today. And in addition to that, we have 6 additional deaths for a total of 14 deaths. The 128th death was a 70-year-old male from Cabell County. The 129th death was a 38 years old, female from Kanawha County. The 130th death was an 84-year-old female from Fayette County. The 131st death was a 77-year-old female from Fayette County. Then we have deaths that are 132 is an 80-year-old female from Mercer County. 133rd death was an 87-year-old female from Mercer County. 134th death was an 86-year-old female from Mercer County. 135th death was a 79-year-old female from Mercer County. 136th death was a 91-year-old male from Mercer County. 137th death was a 78-year-old female from Mercer County. 138th death was an 89-year-old female from Mercer County. And the 139th death was a 76-year-old female from Mercer County. We have 2 more. The 140th death, an 83-year-old male from Kanawha County, and the 141st death, a 74-year-old male from Logan County. It's just really sad. And we all know that this is going on all across our nation, and the magnitude of this across our nation is astronomical. You know, we all know that there's a lot of us that would like to think, well, it's just the flu and it's just a bad flu, but it's not that. And we all think that it, could just possibly and hopefully just attack the old and the most vulnerable, and it does, and it targets those that are older primarily. But we can see that in this report we lost a 38-year-old female, and it's just staggering to think about. That 6 months ago, in the U.S., we see old clips and we see thousands of people piled upon each other cheering for a football team, or at a hockey match, or at a hockey game, or at a golf tournament. They're all screaming for Tiger Woods or whomever it may be, and we see the just our family picnics and the Lily reunion in Beckley, and just all the different things that we've had. And it seems like when we see that on TV now, we flinch a little bit, like, well, gosh, boy, we can't do that. My goodness, what if we did that? What would happen? And so it does have the right word, a pandemic. Something that we really have never encountered, and we're trying to get our way through this. And West Virginia, you've done remarkably getting your way through it, but boy, we got a long ways to go. And absolutely, this situation just shows us over and over and over how vulnerable that especially our nursing homes are, and how bad this thing can move and how quickly it can move. So all I can say is over and over and over, please don't let these people become a statistic. It doesn't matter how many, and you may think, well, why take all the time to read through all these and everything? Well, do they not at least deserve this? And that is for me to read through and not just say, now we've lost 17 deaths, let's move on. I want you to really take time to consider we've lost 17 more great West Virginians. The numbers are a little skewed because it didn't get all reported, on exactly the right day, but nevertheless, it's not what we want. Please keep them in your thoughts and prayers. Like I said earlier, the numbers, our daily positivity rate today or yesterday was 1.51. Terrific. It's unbelievable. I was with a Johns Hopkins doc over the weekend, and he was talking that he heads up one of the ICU units at Johns Hopkins. And he said, we were bouncing along at a positivity rate, trying to keep the positivity rate under 10%. And now our positivity rate is running like 28%. Now, I'm not sure exactly where he's referring to, if he's referring to there at the hospital, or he's referring to statewide, and it's probably at the hospital. But it is, if you look at our positivity rate of a daily, our daily positivity rate is 1.51 or 2.37, and you think we're at 2 and they're at 28, well, boy, West Virginia, you're doing great. But when I look at this and I look down here and think we've lost 141 great West Virginians, I just hate it. I really, really hate it. We now have 123 that are hospitalized, up from 122. That's not changed much. Our active cases are 1,914. That's up a little bit from Friday, was 1,823. Again, the national levels are way higher than West Virginia, but at the same time, we just got to continue to wear a mask, absolutely do any and everything you can possibly do to help the elderly. I mean, for crying out loud, if you can go to the grocery store for them or whatever you can do, we got to do. Now, I just want to comment on this and everything. You see on the news where, either the Big 12 or the SEC or maybe the 5 big conferences are all contemplating and could come out today and say, we're done. We're going to cancel the fall season, or we're going to cancel football period or whatever. And that's a big deal. In addition to that, you see over the weekend that now they're reporting 100,000, I think is the number, 100,000 of our kids, young people, young kids, are getting this virus. 100,000 positive cases in the last, I think, 2 weeks. Now, I hope I'm getting this correctly and everything, but all I would say to everyone out there is we're targeting with all of our superintendents, and we're targeting with our Department of Ed, and we're targeting ways we will educate our kids, where it would be full virtual, it would be a hybrid, or it would be in the classrooms. And absolutely, we have all got to know that your governor has said repeatedly just this. We absolutely will do everything in our power to not put our kids and our teachers or our service personnel into any situation that we deem and we feel is unsafe. Now, with all that's going on, all of us need to be adults, and we need to realize that your governor has said to you repeatedly just this. As we continue to move day by day by day by day, what if in the next couple of weeks we have a few 100,000 more young people that are contacting this disease? What if we have cancellations over and over across the land? What will we do? If that be the case, we may very well back up and say, we can't go to school now. We've got to go 100% virtual. On the other hand, if things continue to move and continue to move in a positive way, we're going to absolutely celebrate the fact that we're going to be able to be in school, and we're going to do it on a county by county basis, and we're going to move forward in that way too. I'm telling you, this situation changes not weekly or monthly. This situation changes almost hourly. And we have got to be in a position to be able to pivot and to move. Asking me questions, what if, I would say September the 8th is a long ways away. And what if, as far as going back to practice and practicing football and everything else like that, we surely need to have additional discussions, and I will be in discussion later today with the SSAC in regard to that as well. I mean, look, everybody, I want our kids to be back in school so bad it's unbelievable. I want us to be playing sports, and I want us to be back as close to normal as I possibly can, as quickly as we possibly can. But at the end of the day, we've got to do this. We've got to fight this battle together. We can't turn this into a food fight where people on one side are demanding one thing and others on the other side are demanding something else. I'm really concerned. I'm really concerned about those 100,000 positive cases of the younger people. I'm concerned naturally about our death rate. I'm concerned about what's going on, when all the big conferences across the country say we're not playing. I'm concerned. And so we'll continue to watch. We have plans in place, and we are going to go full steam ahead to be back in school on September the 8th. But I want everybody to know that's watching this that we are going to be able to pivot, and we're going to be able to move, and you have got to be able to do the same thing. This situation is absolutely just as I've said 1,000 times. It changes by the hour, and we have got to be in a position to be able to change by the hour with it. So that's what we're going to try to do. Today we've got Scott Atkins with Workforce with us, and there's an executive order that's been put out by President Trump. It extends the unemployment benefits to $400 a week, down from $600 but up from $200. And I commend President Trump for doing so, because we got to get some money flowing to our people that are out there that are sitting there wondering how in the world they're going to pay the rent, how they're going to keep from being evicted. I mean, for crying out loud, if you're a landlord, please, some way hang on and don't kick our people out on the street. Please. And from the standpoint of us being able to get them dollars and everything, I think the way this thing has been mandated, it's come down that of the 400, 300 of it's going to be paid by the federal government, and 100 of it's going to be expected to be paid by the states. To be perfectly honest, from West Virginia's standpoint, I've been told today, in my briefing, that's going to cost the state of West Virginia $26 million a week. Now, I believe that the federal government will reverse their stance on that, and that they will pay 100% of that. You can ask Scott Atkins questions about that as we, once we get through, and we'll take the questions. But from our standpoint, the question whether or not West Virginia will be able to pay that, whether or not West Virginia will willingly pay that, I would tell you hands down, period, we're going to pay it. West Virginia is going to pay it, from the standpoint that we cannot let our people that are sitting out there with no job, wondering what in the world they're going to do, sit out there and wilt on the vine. We're going to pay it. And very willingly, we're going to pay it and everything. We're hopeful that the federal government is going to reverse where the states don't have to pay the 25%, but we've got the money set aside as we did in how we bucketed the money. Do you remember when I set aside $678 million of the CARES money for the unemployment? Do you remember when we did that? We put aside $278 to backfill our reserve that we had and $400 to go forward to do just this. That's why we did it. And God knows I'm glad we did it. So absolutely, we will be paying it, and we'll be very willingly paying it, and we hope that they'll reverse, and we hope that Congress will quit being a bunch of political babies and everything, and they'll come up with the fourth stimulus plan, or the fifth. I don't know if it's the fourth or the fifth, but whatever it may be, we'll some way, somehow get the people, whether it be the Republicans on the Senate side or the Pelosi and Schulmers of the world, but some way, somehow, everybody's got to get together, because you got people that are sitting out here right now wondering how in the world they're going to make the car payment, what are they going to do? And they're there because of a mandated shutdown level that has happened all the way from the federal government all the way down in order to try to save us from all dying from this thing. And so this is no more their fault than I can fly through the sky, and we're going to take care of those people. And so I very willingly say we're going to pay the 25%. As far as our corrections facilities, you know, we have 8 active cases at the South Central Regional Jail that are inmates, and 1 staff positive there as well. You know, and so what we're going to do is retest all the inmates and the staff at the South Central Regional Jail. In addition to that, we're also really closely monitoring the Southern Regional Jail in Raleigh County. I guess the Southern Regional has 10 positive staff members there. And all the employees are self-quarantining at home. The 1 positive inmate has now recovered that's at Southern. But here's the thing that we're going to have to try to find a way to do. And again, I don't know how we're going to do it, because testing supplies and testing availability on labs and so on like that, we have now tested in West Virginia 326,000 people. Now, we've only got 1,700,000 and some thousand. We have now tested we are heading towards 20% of our whole population has been tested. But we need to develop plans right now to go back through and retest every single person that's in all the nursing homes again. And we need a plan to be able to go through and retest every person in our correctional facilities again. Now, I know these are daunting tasks, because we're trying to test the kids that are coming back to school, and that's just jumping around like a, ping pong ball, because, 1 minute we're completely going back to school at XYZ College, and the next minute, we're bringing freshmen back and graduate students, and so things are changing, and they're changing very rapidly, but we have got to figure a way, some way, somehow, to be able to get to these nursing homes and correctional facilities as quickly as can be, considering all the other constraints, and test everyone at those facilities. From the standpoint of our churches, today we have 7 outbreaks reported in churches in 5 counties. That's Cabell, Grant, Logan, Mason, and Taylor County. I keep going back through the same thing there. Please, social distance. Please, if you're maybe an elderly person, really and truly, You may very well need to think about listening to church on the radio or the television or whatever, and maybe taking just a few weeks to let this thing try to settle down. But whatever you do, if you go, please wear a mask. Please, let's just be loving neighbors to where we're taking care of one another in every way. Our small business grant program's running good. You know, we've reported, you know, there's over 2,000. We just wanted to keep on going. Keep it going, keep it going, keep it going as far as our small businesses get that money. You know, as far as our cities and our counties, we're up to right at $75 million that's gone out. We keep encouraging the same thing, applications and everything, so people can get more and more money out. You know, from our free testing, we're going to be free testing this week in Brooke and Lewis counties and next week in Lincoln County. I keep telling everyone, try to take advantage of getting a test, especially our minorities. From the standpoint of summer feeding, we don't want a West Virginian unfed at all. We got 696 sites. You know, if you have trouble, call 211 and we'll help you. I remind you again about the census and everything to get counted. And I'd wrap up by just saying just this, that as we continue to go forward and battle this battle and battle it together, you know, we have got to have all of us trying to continue to pull the rope together instead of push the rope, because it's just not going to work. You know, everybody is trying with all in them to push the right buttons and do the right things, and we're going to continue to do so. But one of the things that we drew some criticism on this and everything, which was completely unfounded, when all of a sudden, you know, we were drawing criticism on how we sent the CARES money out, that we didn't send the CARES money, you know, out as fast as we should. And then all of a sudden, lo and behold, we found out that we were ranked 4th in the nation as far as how fast we got the money out. You know, and then all of a sudden, lo and behold, we've got a situation that's confronting us right now where our president says the federal government's going to cover 3/4, and you, West Virginia, are going to have to cover the other 1/4 for the people that are on unemployment that are sitting out there and don't know what to do. You know, you're going to have to cover that, West Virginia. And if we hadn't set aside money to be able to do so, what would we do? What would we do? But we did it. We set aside the money over in the CARES money. We set aside the $678 million, and we've got money there to be able to handle this situation without absolutely laying a burden on our businesses like you can't imagine, and having to raise taxes like you can't imagine to be able to cover these dollars. We've got the money sitting there to be able to do it. But that's what I'm saying. We did the things that were prudent and the right buttons to push. It is very, very difficult to know which buttons to push in this whole situation, as every one of us know. We pray, and we pray to God above that some way, somehow, he's going to get us through this and tell us the right decisions to make. But for those of you that are out there that are wondering everything from the standpoint of getting your unemployment benefits, you're going to get them. And I think our president's doing everything that he can possibly do as well. We just need to stop the food fight in Washington. But nevertheless, that's all I got today, and continue to keep us in your prayers.
All right, thank you, Governor. Let's first go to Bill Crouch, Secretary of the West Virginia DHHR, and Dr. Ayn Amjad, our State Health Officer.
Thank you. Good afternoon, everyone. I want to talk just a couple of minutes about our outbreaks in long-term care facilities. Governor is right on point with regard to circumstances changing hourly. We really are staying on top of these and following these, so we wanted to give a little report on where we are. Raleigh County, we have 85 active cases in Raleigh County right now. We're working with Pine Lodge, a little concerned with regard to that outbreak, 33 residents and 13 staff at this point. We've heard there may be a couple more this morning. Again, our report's now at 10 a.m. on the website are through midnight of the previous day. There will always be some adjustment of numbers and reports at the local level with regard to numbers that may differ. But we're working with Pine Lodge. Grant County, we have the outbreak at the Grant Rehab and Care Facility. That includes 33 residents and 9 staff. Logan County, as I mentioned last week, we still have great concerns and are in very close contact with quite a few folks in Logan County and trying to provide all the resources we can provide. But Trinity Healthcare Center is a facility that we're working with right now that we tested last week as a result of the outbreak, and we're seeing more cases there. So we're working closely with them, and of course Mercer County. We're still looking and working closely with Mercer County in terms of that outbreak. And I'll let Dr. Amjad speak about that a little more in just a second. I first want to thank the Guard. Again, without the Guard doing their deep cleaning of these facilities, their airflow studies, and making sure that there's adequate PPE, we would truly be struggling. And let me mention, we have 30 outbreaks in long-term care facilities and nursing homes. Most of these are 1 or 2 cases, so we're trying to make sure those do not grow further and end up being large outbreaks. The outbreaks in our facilities are a little different than community outbreaks, but keep in mind we have staff in those facilities who are part of the community, and that's where the community spread generally is introduced into the facility. Let me mention quickly St. Francis. We talked about St. Francis last week. Governor Justice asked us to stand up St. Francis and have that hospital ready as a surge hospital. Thomas Health System has done a terrific job doing that. We have 15 beds that have been activated and put in use as for COVID-19 patients. St. Francis is now our operating surge hospital in West Virginia. If needed, St. Francis can increase those beds up to 75 and perhaps more. Last week they announced they were ready to accept patients. We have now transferred patients in the state to St. Francis Hospital, and I want to thank again Thomas Health Systems and Dan Laufer for what they're doing as a partner with us. With that, I'll let Dr. Amjad provide a little more detail on a couple of these issues. Thank you.
Thank you. Good afternoon. First of all, there are a lot of questions about Princeton Healthcare Center, Mercer County, the Mercer Health Department, and we tried to answer a lot of those questions this weekend and did speak with Metro News about them. And I think there was some confusion about how the 8 individuals who passed away was reported. And to clarify that, I want to say that a lot of things are done by paperwork, not by word of mouth. And I think some of the confusion with that is, we have to be very careful and sensitive of how we relay information to the public. And myself, I've always used death certificates even before I speak with family members, putting things in the newspaper. We use that, but really our dashboard and the way we relay information to the public is we use something called a death report. That death report is what we use very carefully before we put things out there. And unfortunately, what happened in Mercer County and with Princeton Healthcare Center is these we'll just call them reports from now on because, don't like to keep saying death so much. These reports were not filled out due to the change in staffing, which had occurred down in Mercer County. The Princeton Healthcare Center has been working very hard. The staff there has been overwhelmed. They have their own staff who is sick. Their own medical director had been out, and these reports had not been filled out in time. So unfortunately, over the weekend, we knew these reports had to be filled out, which we had them done as fast as possible, which is why that number 8 came out over the weekend, which of course shocked everybody. Unfortunately, the families there had known this. They had been notified, of course, of their loved ones, but no one else knew this. But reporting something to us is important. We want to be accurate. We want to be clear with people, and we also want to be sensitive. The staff there as well has been working very hard. They're very upset. These are family members to them as well. but this reporting method is what we use. So that's what we're trying to get clear. But moving forward, we're trying to make that clear to people in the hospitals, local health departments, of being accurate and timely. Timely is very important to get crucial information out. But that's why this number came out as such. But it's a matter of personnel changes, getting paperwork out there, and so forth. But if there's more questions, we're going to be trying to address those as the days go by. But that's for Mercer County. As far as the other counties, we are working diligently with trying to get infection control. We're trying to help the nursing homes as much as possible. St. Francis we brought up, as Secretary Crouch mentioned. They're doing very well with that. The patients that are there now are 5. They are actually from Princeton Healthcare Center, and we can answer more questions. St. Francis also has a communications director there to answer questions, but if there's anything else there, we can answer those appropriately as time allows. Thank you.
Okay, thank you. Next, we have Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. Picking up on where the governor commented earlier, a new report came out that did demonstrate that 97,000 children in our country had been infected with the COVID-19 virus over the last 2 weeks of July. That makes about 380,000 total children that have been infected. About 570 or so have developed serious and sometimes life-threatening problems, this so-called multi-organ inflammatory syndrome that causes inflammation of the great blood vessels. And to date, about 80 children have died, as I remember. So as we look at West Virginia, as the governor said, we have seen a reduction in our RT rate overall, which is good news. Certainly the southern part of the state is not quite in the same step with that. So Logan and McDowell counties still have a higher RT value, as well as several other counties in the southern part of the state. And these are areas that we know have the most vulnerable people in our state. And as the governor also mentioned, as did Secretary Crouch and Commissioner Amjad, that we are also seeing new outbreaks in nursing homes and congregate settings. And as we've said before, that this is not unexpected, as we've gone from the first part of COVID being in urban centers to now being in rural America and rural centers. What we find is that that spread is brought in from the community, even though we see it in these congregate settings. And that's similar to what Sweden has seen as well. You can't separate you can't just protect people in nursing homes or other congregate settings from the transmission back and forth from the communities. So it's really important for us today to really focus on paying the most attention to these mitigation measures, particularly as we are contemplating and trying to reopen our schools and trying to reopen the parts of our life that we value so dearly. This is a time that in America, that even though we've seen some reduction in cases, that we haven't seen a sustained reduction in deaths. And I believe that's because vulnerable people in our population are now becoming infected, as well as children. So West Virginia, it's really, really important that in all parts of our state, we wear our masks when we're out, we stay home when we can, we stay physically distanced 6 feet or greater from those people that we don't live with all the time. We wash our hands, and we become very much more engaged and more conscious and more cognizant of the environments we're in. So for instance, churches and other big gathering events, remember the 3 C's from Japan: avoid crowds, avoid closed indoor spaces, and avoid constant contact with people you don't live with, 15 minutes or more, and wear your mask and stay physically distanced. And we will continue to do well through the COVID pandemic. But we see that even West Virginia, that's been relatively protected, is not invulnerable from having people die of COVID-19. So thank you.
Okay, thank you, Dr. Marsh. Next, we have Major General Hoyer with the West Virginia National Guard.
Good afternoon. Significant focus over the next couple of weeks for the National Guard will be providing sanitization, testing support, and technical expertise to particularly southern West Virginia counties, to our nursing home facilities and our local health departments and our long-term care facilities. We'll continue to focus on ensuring we have the appropriate amount of PPE available. As the governor pointed out, we have significant challenges moving forward that we need to address, and we're refocusing our efforts to be the quick reaction force to support the Bureau of Public Health and our local health departments and facilities as needed. I just would like to point out that this is day 150. I've been in the Guard for 39 and a half years and responded to a number of emergencies. This is the longest operational period for a state emergency response that I've seen in those 39 years plus of service. So on behalf of the governor, our first responders, our healthcare workers, and those National Guardsmen on the front line of this effort, I would ask that all of us continue to double down and follow the mandates and do the things that we need to do to protect others. As the governor pointed out, if you've got a vulnerable neighbor, work to support them and take care of them. Those of us on the front line of this need your assistance, West Virginia, to address this threat. Thank you.
Okay, thank you, Major General Hoyer. Scott Atkins, Acting Commissioner of Workforce West Virginia, and Betsy Jividen, Commissioner of the West Virginia Division of Corrections and Rehabilitation, are also joining us today and are available for questions. Our first media question today is from Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. This question is probably more for Scott Atkins, for sure, but with that executive order, have we been in communications with anybody with, I guess it would be White House, U.S. Treasury Department? How is this going to be implemented with doing this reduced $600 to $400 benefit? Do we have any type of answers on that, on how that's going to work, at least in the short run? Thank you.
Stephen, that's a great question. The executive order provides funding from FEMA to pay the extra $300 that the governor mentioned earlier. It's set up a lot different than what we at Workforce have historically done through the U.S. Department of Labor. We're still working with their partners, including FEMA and the U.S. Department of Labor, to figure out how that's going to work. But what I can tell you is, folks who are receiving unemployment benefits currently, if they receive $100 in any kind of unemployment benefit, they're going to be eligible for the $400. So there's nothing to do on the part of the unemployment claimant other than just continue to file their weekly certifications. And so mechanically, we're still working through that. We're hoping to hear more today or tomorrow on what that's going to look like. But keep in mind also that the benefits are retroactive to the week that ends on August the 1st. So if it's this week or early next week before those benefits are up and running, those benefits will be retroactive to the week ending August the 1st.
Okay, thank you, Steve. Our next question comes from Charles Young with WV News.
Hi, this is Charles Young with WV News. Given what we just talked about the rising number of cases identified among children and younger people, do we have any plans to implement widespread testing for school students and school staff, teachers, service personnel? Are we going to test all those folks before we try and head back? Thank you.
Okay. Somebody from our medical community speak, or Secretary Crouch, go ahead and speak, and then I'll wrap it up.
Yes, sir, Governor. This is Bill. We have had discussions about testing. As everyone knows, we're looking right now at testing colleges and university students who are coming back in, especially those from out of state and out of the country, but even West Virginians who are relocating and going back to their schools or staying on campuses. We have a little bit of time here with regard to the September 8th date, so that discussion is ongoing. We're looking at testing With regard to K through 12, we have not made any decisions on that. As we move forward, we'll make that information available to everyone.
Maybe Charles, I could just add to this, and that's why I say that we've got to all realize, and I'm speaking to our Department of Ed, I'm speaking to all parents, I'm speaking to our kids, I'm speaking to the SSAC. Everybody here has got to completely realize that we have got to be in a position to pivot however we would end up pivoting. If you know, Charles, just like your question, you know, comes up and says, well, should we not be in a position, should we not be looking at testing all the children that are going back to school? Well, Friday, that probably wouldn't have been in your mind. Now it's not only in your mind, but it's in my mind and lots of our minds. As we go forward, there'll be more and more data that will be coming out. At this moment, right this second, if you said we've got to test, or we want to test every child going into every school, as well as all of the staff and everybody that's there. At this moment, West Virginia does not have the capability to do that. But can we continue to work towards that being accomplished, and maybe even have the ability to be able to do that, even maybe possibly before September the 8th, if it is deemed necessary to have to do, or necessary that we want to do. But this is part of the entire situation. As it changes and changes hourly, we have got to be willing to be able to move and change as well. From the standpoint of, you know, do we end up in a situation to where we have to do what the Big 12 conference is doing with football? Maybe we have to do a situation to where we don't go back on September the 8th. I hope and pray that we're going to be able to do that, because all of us want our children back at school. But absolutely, we've got to know we have got to do what is the safest and best thing for our kids. We don't need a catastrophe on our hands with our teachers, our service personnel, our kids. We don't need to be divided. We need to do the smart thing. And every day that goes by, we'll learn more. And as we get closer and closer, we'll be able to fine-tune exactly what to do.
Okay, thank you, Charles. Next, we have Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Let me give you something that is not going to change. A high percentage of West Virginia students live with their grandparents, or their grandparents live with them. Should these students be considering going all virtual in the fall rather than going back to school, if that is an option? Or do they risk taking the virus back to their grandparents and putting that at-risk population in jeopardy?
Well, Paul, my answer would be real straightforward and real simple, and it's just this: the first and foremost, the parents and the grandparents have to be able to make that decision and make that decision themselves. But from the standpoint of where we stand right today, our numbers would indicate that we're okay. We're okay to be going back to school and taking care of those kids and doing all that. But at the same time, you know, you make a very valid point. And if I were a grandparent and had a child, you know, that was that I felt like could really get, you know, everything that he or she needed from the standpoint of the virtual side and everything, it would be something that I would very seriously consider. Let me add another thought. I just thought about this. We've got to weigh this out too, Paul. We've got to weigh out the emotional impact of what's going on with these kids. You know, we've had kids, like I said, that we haven't laid eyes on for 5 months. And we have kids that are hungry and have all kinds of things that are going on, maybe that are bad things. We have all kinds of special needs situations and everything. We have so much support stuff that needs to be done that we can't forget that too. And so, yeah, this is one of those that truly is daggone if you do and daggone if you don't. There's no simpler, absolute, there's no good answer. There's really not a good answer here.
Okay, thank you, Paul. Next, we have Kenny Bass with WCHS and Fox 11.
Hi, it's Kenny Bass from Channel 8 and Fox 11 in Charleston. Governor, I've asked you this a couple of times, and the variables on this keep changing, as you mentioned. So let me try to winnow this down and ask you specifically something that you may be able to answer, you may not. With all of the things that are floating about going back to school and statements made that we don't want to put kids in danger, we don't want to put teachers in danger, we don't want to put school service personnel in danger, September 8th is a floating date, et cetera, et cetera. The first part of this is, what is an acceptable level of hazard that you or the education community is willing to put up with, knowing that there is no totally fail-safe method to put people back in school during the pandemic? That's the first thing. And secondly, while we're waiting on September 8th, what is your date in your head right now? You can't wait till September 8th to announce we're not going to school, or we are. So are you looking, would it be September 1st, that week sometime? What is your deadline date, your absolute last moment date where you're going to make a decision based on whatever information you have at the time about school? Thank you very much.
Okay, Kenny, thank you too. To answer the first part of the question, it'd just be this, we're going to have our medical experts and our experts in the education community guide us on the numbers. Kenny, we all know there is an impact, a significant impact to the downside by our children not being in school. And whether it be, emotional, whether it be, abuse maybe, or whether it be meals or whatever it may be, there is really a downside by our kids not being in school. From that standpoint, that's where we got to weigh more, really, I guess, on the education community, really, than our medical experts. But at the same time, we're relying on them to give us some level of guidance on that. From the standpoint of our numbers, we're watching these numbers, we're on top of this as best we can possibly be. Kenny, if we didn't have the outbreaks that are going on right now from the standpoint of people running off to Myrtle Beach and bringing them back, and a staff member going into a nursing home and affecting everybody in the nursing home, if we didn't have that going on right now, we'd be looking at our numbers and we'd all be celebrating heading back to school. And we'd be happy as we could be with doing just that. From the standpoint of a drop dead date, I think, Kenny, really and truly, it's got to be September the 1st or before, because you can't get up in the early days of September and then decide what you're going to do unless we just have, some catastrophic event that happens in that time period. But I can assure you that everybody is all hands on deck, and everybody is working these numbers and trying to make the very, very, very best possible decisions that people can make. It is not going to be flawless no matter what you do. You cannot remove the risk today. We cannot do it today. We cannot do it until we have vaccines or drugs, if in fact we do. And you know what that's going to be too. You're going to have a lot of people across our land, a lot of West Virginians, but a lot of people across this country that are going to be reluctant to take the vaccines. And so September 1st, no later than September 1st, from the standpoint of what to do to proceed forward or not, has got to come from the numbers, and it's got to come from the medical team and medical experts, as well as the education community.
All right, thank you, Kenny. Next, we have David Beard with the Dominion Post.
Hi. Where you have 30 nursing home outbreaks across the state, and most of it coming from community spread, is it possible that the protocols aren't adequate for the staff reporting to work and the visitors coming in to check visit their families? Do you think you might need some kind of beefed up statewide mandated standard that everyone has to follow uniformly rather than leaving it piecemeal? Thanks.
Well, David, let me jump back in again and say just this, that we've already been in discussion internally, from the standpoint of our staff within the governor's office and looking at moving back into a no visitation situation with our nursing homes. We absolutely, are looking at ways to better screen our staff, and just from the standpoint of, of all things, how in the world could one place, Myrtle Beach, keep just jumping at us? And so we're looking at that and beefing up the possibilities of what to do with our staff, as well as what to do with visitation, and as well as to do with retesting every nursing home, every person in every nursing home in the state. Because if we don't jump on this right now, it's already bad enough. But as we have said over and over, how many times, West Virginia, have you heard me say, West Virginia is the oldest state. West Virginia is the most chronically ill state. We are absolutely positioned in a spot that could absolutely have an outbreak like you can't control. We do not have hospitals, especially in the southern part of the state, that can handle this kind of problem. We are, how many times have I said exactly that? And to be running off to a place like Myrtle Beach, coming back, doing those kind of things, not wearing masks, not distancing in the churches and all that's going to catch us. It's just going to catch us. And then when it catches us, it could be with a grip like we can't get away from. And so, we're going to just stay on top of it, and then maybe some additional, guidance as far as the staff needs to be done, maybe the standpoint of the no visitation, maybe, and absolutely, if we, as fast as we can physically do it, we need to test everybody in all the nursing homes.
All right, thank you, David. Next, we have Mark Curtis with Nexstar Media.
Good afternoon, Governor and everyone. I want to go back to the unemployment question because it appears we may have a legal challenge here. Democrats in Congress don't think the president has the authority to do what he did. They may go to court and get an injunction, or they may wait to pass their own bill. Given that that may bog things down for another couple of weeks, Governor Justice, are you willing to go ahead and spend and distribute the state's portion, that 25% from the CARES Act funding, regardless of the legal challenge, regardless of what Congress does on this?
Mark, I'll make this really simple. I am 100%, and the reason I am is just this. Our people that are unemployed and they're sitting at home with Congress playing the games that they're playing, and all it is a political circus. And absolutely, our people that are sitting at home don't need a governor that's sitting there waiting on the political circus. Now, at the end of the day, we'll figure it out. We'll figure out what to do. But I really believe our government will step back in and backfill the shortfalls and whatever. But if they don't, we've got the money set aside to do it. And our people deserve that, and there's no way in the world that I'm not going to do it.
All right, thanks, Mark. We have time for one more question. We'll go to Brad McElhaney with West Virginia Metro News.
Hi, Governor. Hi, Dr. Amjad. Hi, Secretary Crouch. Hi, everyone. I mentioned Secretary Crouch and Dr. Amjad because I have a question about what's happening at the nursing homes. Over the weekend, regarding the Princeton situation, some people reached out to me questioning whether staff had had the appropriate personal protective equipment at that nursing home as the outbreak began to take shape. There were also some questions about, given the status of the Mercer County Health Department, if there is adequate contact tracing there. But given that there is a broader situation with nursing homes around the state, I'd kind of like to extrapolate those questions outward to other nursing homes. Do they have the personal protective gear they need for staff? And do these counties that are being hit right now have the capability of contact tracing? Thank you.
Yes, Governor, okay
No,
to start?
You guys go, talk.
All right, thank you, Brad. Good question. Again, we have 30 nursing home outbreaks in the state, and I listed I believe 4 that we're following the closest and most concerned about. Those are great questions. First of all, the PPE, the Guard is assisting with that, and Dr. Amjad actually got involved in the Princeton PPE situation to make sure that there was proper fit for individuals. I spoke to the administrator of Princeton Nursing Home myself several times. It was last week that issue came up, and she assured me that the Princeton Rescue Squad, I believe, were doing the fitting for the N95. So we have asked the Guard again to step up, and they respond every time by going in and providing additional assistance. So we're revisiting that issue everywhere. So it's a good question. With regard to contact tracing, and I'll let Dr. Amjad add to that here in a second, but in terms of contact tracing, that is an issue everywhere, but we actually want to make sure, and we spoke Friday with all of the local health departments in the state on a weekly call to make sure they understood that we have additional contact tracers that we are able to provide to them to assist with contact tracing. We actually implemented the checks out system with 7 counties this weekend, and that seemed to go very smoothly. We have additional health departments coming on next week and the following week until we get everyone on. So that's going to help with regard to contact tracing. Actually allows us to increase that number significantly once we get everyone on board. So we are working hard. I actually sent an email this weekend with regard to one of the nursing homes I mentioned, Trinity, to look to give them priority in testing since they are increasing in numbers. So we're going to try to speed up their test results, but also to reach out to have someone reach out to them to see if they needed additional contact tracing resources. Our folks did that, and we are doing that contact tracing, but that seems to be going well. There didn't seem to be any concerns with that contact. So we're trying to do the same thing with everyone out there as we see these numbers increase. So those are great questions, a good point. Dr. Amjad, would you like to add that?
No, Brad, but just to reiterate, all nursing homes do have PPE, and we do reinforce to make sure everything is in line, but Princeton did have it. EMS did make sure they're fit tested with the N95. The National Guard did go in to help them and double check everything, but all nursing homes have their own supplies. We double check with them to make sure it's fit. National Guard has been very good to go in and help them and go back in to check things. If we see something that doesn't seem in line, we go back in again and recheck it because we do want to make sure everything is working. But they all have supplies. They call us to give them more supplies. We double check with them. Those things are always, because that's the first line of infection control with us. And we always double check those things. But we have different methods to fall back on and see, because everyone needs those supplies.
And Brad, let me add one other thing. Again, the Guard has been fantastic in going to these facilities and looking at airflow in these facilities. As you may have heard us talk about in the past, negative pressure helps in terms of making sure that the spread of this disease is not aerialized, and there have been several studies on that. So the Guard's been very good at helping facilities seal off a wing to make sure that those patients who are positive are isolated from other patients, and to make sure that there's no traffic through those areas. Dr. Amjad has been very good about going out and kind of confirming that as well. And the deep cleaning piece, we're deep cleaning, or the Guard is primarily deep cleaning wings at a time, offices in nursing homes. So again, this is a huge problem, but we think we're on top of it as best we can right now. As the governor said, it changes hourly, but we're trying to respond very quickly to these. Thank you.
All right, Brad, thank you. Governor Justice, back to you.
Okay, well, thank everybody, or thanks everybody, and you know, West Virginia, you have You've responded miraculously, as I've said over and over, but you've counted on me to tell you the truth. And I think you've really seen that that's exactly what I'm going to do. Now, I'm going to tell you one more bit of truth right now, and I really would appreciate your attention on this too. Because the last thing on the planet I'm going to ever do is tell you anything but the truth, no matter the level of pain to me or whatever it may be. From the first thing I would tell you is just this. The idea that West Virginia is protected from this terrible killer, and the reason that the numbers are low is because we have mountains, or we're distanced, or we have communities that aren't as big cities, or whatever it may be. That's not right. That's just not right, West Virginia. You have done an amazing job, really taking care of yourself and protecting your neighbor, and you have done an amazing job. Whether a city have 5 million or 50,000, it's still a city, and there's still people that are piled on top of one another. West Virginia is just what I have said over and over and over. We're an old state. In addition to having an old population, we have people that have chronic illnesses. Where does this disease really attack? It attacks our lungs right off the get-go, where we can't breathe. We have so many people in West Virginia, whether it be black lung or COPD or whatever it may be, we have that all over the place in West Virginia. Diabetes is absolutely a crippler in regard to this disease. We have it everywhere. Absolutely, West Virginia, you are not protected. You are not protected by your mountains. You are not protected by an ocean that's all the way around you. You have no ocean, and the mountains are not protecting you. What has protected you is you. You have listened. I have told you the truth, and you've listened. Now, I'd ask you just this. If you are really honest with yourself, as honest as I want you to be right now, I would say when we shut things down and we were having people have to stay home, and we were closing businesses and saying work from home, and we were saying to you that the churches had to be closed, or we never really said that, but we said we highly recommended that the elderly don't go. And when we were saying to you that we kept in work the essential businesses, whether it be the grocery stores or whatever, how did you react? How did you react, West Virginia? You were afraid. And you absolutely protected your family and your loved ones in every way. You stayed home. You really, really, really made the miracle happen right then. Right then, when we closed visitation to the nursing homes, when we closed our schools, when we stopped the state basketball tournament, you, West Virginia, made it happen. Now be honest. Be really, really honest. When you're driving around now and you're looking at groups that are walking around or wherever they may be, you know, are we doing as good a job today as we were doing at that point in time? Now, I get it. There was a stay-at-home order. Now there's not. I get that. You know, but are we trying with the same level of concern that we had then? Are we doing that today? And if you're brutally honest, you'd say no. You'd say no. So the net of the whole thing is just this. West Virginia, we have the oldest and the most sick. And absolutely, this thing can absolutely just jerk our guts out. You're doing really good. We want to go back to school, but you can do better. We all can do better. And in this situation, we have got to belly up to the situation that we have got to do better. Please, please listen to me again, West Virginia. I am proud of the job you've done, but we've got to do better. We have got to do more. We have got to slow this killer because this thing could get worse and worse and worse. And then we could be in a situation to where we absolutely cannot stop it. So West Virginia, come on. Absolutely. Go with me. Go with me hand in hand, and we're going to get across the finish line. The last thing I would say is just this comment. You know, Brad, you're a great reporter, and I have all the respect in the world. You know, you said, should we be looking at a broader or more comprehensive thing because of the situation that's going on within our nursing homes statewide? Man, you're splitting the bullseye. Absolutely. We should absolutely be more concerned, have a broader approach, but the reality is just this. The broader approach, or the broader access, or the broader belief of what is going on across the state is the same broader that everybody is worried about across our nation. Just think of the nursing home deaths across our nation. The percentage of nursing home deaths is unbelievable across our nation. But also think of the broader across the world. It's the same thing. This thing attacks the old. And we absolutely need to protect our old and know that that is the number one target of this killer. We got to protect our children. No question about that. We got to keep our head up, and we got to keep being fluid and be able to move. But you're dead right in that we should be concerned about the broader approach across our state, because this is the concern of the broader approach across our nation as well as the world. We're going to get through this, West Virginia, but it is tough stuff. Please just absolutely join in helping me get us through this. Absolutely. If you were honest as you could be with where we were and how much concern you had and how much thought you put into this at the time of a stay-at-home order to today, we're not as concerned today. And absolutely, we need to get back there. Not get back to a stay-at-home approach and shut down everything. Just get back there to a mindset to where we can some way, somehow step up to another level and absolutely try to prevent and do everything we can to stop this. Anyway, thank you so much.